here's something over there. Literally, you just take your finger over those areas, push down on their chest like that, and then you just tap it. And kind of like a flicking motion. And then the other side, and you compare them from side to side like that. And you will hear either dull or hollow sounds. And if it's dull over the lungs, that's an adventitious finding. There is something there, it's a consolidation that is not allowing sound to penetrate through those lungs. And then here's one other test that you did. So you did that. You percussed it, you found dull sounds over here. And I know this sounds weird, but you have the patient say E, 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 over and over and over. And listen back and forth here. If there's a consolidation there, over here you're going to hear E, E, and you'll hear it as an E. But if there's consolidation in that part of the lung, that E is going to sound like an A. So they'll say E, but you're going to hear A because it distorts the sound and changes the letter. Actually hear it as an A. And it's an E to A, egophony is what that's called. Kind of interesting. And you can, which this takes, I've yet to feel it, but you can put your hands over both sides and once again have them either go 1, 2, 3 or E, and you can feel vibration through your hands. Once again, I think that will take a little bit of practice to feel that on sick lungs. And they call it fremitus, and you can actually feel the vibration into your hand from that consolidation, kind of bouncing sound waves back and forth. But me personally, I would just do the egophony, that E to A change, and then the percussion, if you found something. Because then you've got 3 findings there. I found decreased lung sounds with maybe fine crackles, maybe some wheezes on the left lower lobe. I did percussion was positive for dull sound on percussion, and they had a positive E to A change with egophony. That is really truly diagnostic for pneumonia without having an X-ray right there. Pneumonia or pus or whatever else is in the lung there. But if they got fever and chills, they've been sick, they've been coughing up yucky colored sputum for several days, that's pneumonia until proven otherwise. And then they can do a chest X-ray to confirm it. But you could definitively say, wow, that's a pneumonia. Yeah, crackles, they got rid of bronchi now. They want you to use bronchi.
Yeah, just because some people think bronchi is more like a wheeze, right. and there's just a lot of.
So they switch it now. It's just crackles and wheezes. Yeah. So if you hear crackles, and that's what who here has listened to lungs and heard like what you thought was fluid in there, and you hear it crackling around. All right, pretty much everybody probably have. That could be fluid in there. It could be consolidation from a pneumonia. It could be pus in their lungs. It's many different things. Consolidation is whatever it is. It could be infection. It could be pus. It could be fluid. It's whatever's there, but it's going to make that dull sound there, and it's going to change those lung sounds. If they have fever, chills, rigors, any of that stuff, and they've got consolidation, that's an infection. That's until proven otherwise, and they should be treated for that in that way. All right.